Introduction. Hearing plays a critical role in a child's social, emotional, and cognitive development. A mild or partial hearing loss can affect a child's ability to speak and understand language. Hearing problems may not become obvious until children are 12 to 18 months of age, when they should begin saying their first words. Causes. The ear is divided into three parts: the external, middle, and inner ear. The external and middle ear function to conduct and transfer sound. The inner ear functions to receive the sound and send signals to the brain. An abnormality in the external or middle ear that affects hearing is referred to as conductive hearing loss. Problems in the inner ear that affect hearing are referred to as sensorineural hearing loss. Mixed impairment can result in hearing loss due to a problem in both the middle and inner ear. Hearing disorders in children may be present at birth or acquired later in childhood. Conductive hearing disorders that occur congenitally may be associated with various medical conditions such as Down's syndrome, Crouzon's disease, Marfan's syndrome, and Pierre-Robin syndrome. Conditions that cause conductive hearing loss later in childhood include otitis media or middle ear infection, trauma, excessive wax, and foreign bodies. Sensorineural hearing disorders that occur congenitally may be associated with preterm delivery, low birth weight, perinatal hypoxia, and hyperbilirubinemia. Conditions that cause sensorineural hearing loss later in childhood include meningitis, viral labyrinthitis, autoimmune disease, metabolic disease, tumors, complicated otitis media, ototoxic drugs, and infections such as measles and mumps. Signs and symptoms. Signs and symptoms of hearing loss in children are often not recognized until a child has problems with speech. A hearing problem may be identified earlier if your child fails to meet certain milestones. Newborn babies up to 8 weeks of age will be startled by sudden noises nearby. At 8 weeks to 4 months, they can look toward the direction of a sound. At 6 to 12 months, babies turn their heads towards known voices and start to babble. At 12 to 18 months, they begin to imitate simple words and sounds. At 18 to 24 months, they can understand simple directions. At 2 to 4 years, they have clear speech with a fair vocabulary. Older children with hearing loss may not respond when called. They may talk too loudly and watch television with the volume turned up. They may pronounce words incorrectly and may be inattentive and perform poorly at school. Diagnosis. If you feel your child has a hearing disorder, you should have it evaluated by a doctor. Your doctor will review your child's medical history and perform a physical examination. An otoscope is used to examine the ear. Special hearing tests are performed, such as the auditory brainstem response test, where your child listens to clicking sounds through an earphone, while an electrode is used to measure the response of the hearing nerve. Another test performed is the otoacoustic emission test, which measures the echo response of cells in the inner ear. Audiometry is a standard test that determines your child's ability to hear sounds of different frequencies. Tympanometry examines how the eardrum and middle ear respond to changes in air pressure and can be used to detect eardrum perforation or fluid in the middle ear. Treatment. Hearing disorders are best detected and treated early to prevent speech and learning disabilities. Certain hearing disorders may be treated by addressing the underlying cause. This includes treating acute infections with antibiotics or removing foreign bodies from the ear. A hearing aid may be prescribed to amplify sound. Certain devices called vibrotactile aids convert sound into vibrations that are felt through the skin. Your child may need speech therapy. Surgery may be recommended in certain cases. This may involve repairing the eardrum, removing scar tissue from the middle ear, or placement of ear tubes to treat effusion due to chronic middle ear infection. Cochlear implants may help in cases of profound hearing loss when the cochlea, which converts sound vibrations into nerve impulses, is damaged. These implants are placed within the ear and help transmit sound directly to the hearing nerve. Summary: the human ear is an intricate structure of the body that enables us to hear sounds, to help understand the world around us. Hearing disorders may be difficult to detect in children. The earlier hearing loss is identified, the better it is for the child's language, learning, and overall development.